Hey you,
Hi.
it's us, your parents. You might be asking what's so funny. Well, we just went on a 10-minute rant and went to go hit stop, and then the camera started recording. So
I'm not the only bad one when it comes
So,
to the GoPro.
part two.
Apparently.
I guess I just got the I'm just taking on the pregnancy brain for your mom. Okay, so we are on our way out to Durham for our next appointment, and it should be ultrasound day. So on today's ultrasound, it's been 2 weeks since our last checkout, and on today's ultrasound, we'll be looking to see that you are there and that all your parts are where they're supposed to be, and hopefully see and hear a heartbeat. Definitely, we at least want to see a heartbeat. We may or may not hear a heartbeat. It's kind of back and forth whether or not you'll hear one this early. So we'll see. So the past couple weeks has been a little bit mentally trying. When you're getting checkups every couple days to then going 2 weeks without a checkup, there's a lot of what's going on inside your mind. When you include that with some of the kind of things that your mom's been going through, with cramps and spotting, it makes you a little bit nervous about what's going on. So what kind of things over the past couple weeks have you been going through and experiencing?
A lot of gas, nausea, not being able to sleep more than like an hour and a half straight. I keep waking up in the middle of the night. I'm peeing a lot more. Really always tired, more than usual. Because I read it and it said, especially what's causing a bunch of sleepless nights is it's a lot of hormones rushing to the uterus. So it basically messes up the sleeping pattern. Started to have some backache, and I don't know why. It's not pain. It's just a lot of just soreness. It's like I feel like I need a massage all the time. And a really big bloat now because I don't fit in any of my regular pants anymore.
So yeah, so much bloat to the point that your mom is now wearing maternity pants to keep a level of comfort while she's at work and throughout the day. So like we talked about, some of the things that your mom's been going through with the nausea. We picked up some Preggy drops from the store. That seems to be helping with some of the nausea. No vomiting so far, just nausea. So hopefully it stays like that and just gets better from that point. And then obviously good old ginger ale to help out with that too. Still taking
excuse me, see?
There you go. Still taking progesterone every night. 1 shot of progesterone in the old bum cheek to help keep those levels growing. So that's really only thing that's been going on as far as what we've been doing. Some of the other things that have been going on is some of the cramping. So we'll let mom explain what that cramping's been like.
The cramping's been more mentally like worrisome for me. It was never really severely painful, or it was not really ever painful at all. It was just me, being paranoid because I'm very paranoid about everything. So it's sometimes just on one side. I felt it on my back, and then sometimes it's all over. But I feel it more when I'm on my feet, because when I'm at work, I'm always on my feet running around, and so basically every time I'm at home, I do the bare minimum of physical activity to kind of ease my mind about, oddly as it seemed, like dropping you. So that's it.
So I have been doing a lot of research and reading into the cramping. A lot of it, they say, is from just the growth that's going on inside. You know, a lot of the times we relate cramping to problems in pregnancy, but you gotta remember 2 weeks ago when the transfer happened, you were
3 weeks.
Or 3 weeks ago when the transfer happened, you're microscopic, and then by the time you latch, they say you're about the size of a pinhead. So now, at this point, you're 10,000 times larger than you were then, so about the size of a blueberry, which when you had nothing inside your body before, that's a pretty large size foreign body going on. So that plays a little bit into the cramping. With the spotting, it hasn't been blood, just more mucus, so that's pretty normal.
Excuse me.
But you know, the concern's always there. So you know, if you ask like what our mental state is with the pregnancy and the creation of you, although it sounds cold and distant, but it's just the way that we deal with things. We're absolutely excited with the idea that you're on your way, but we kind of hold up a little bit of emotional wall to prepare us in case if things don't work out. You know, we're still pushing towards that third trimester. Mom's seven weeks and 1 day today, so that puts us about a little over 4 weeks left, almost 5 weeks until we're out of that so-called danger zone.
Look, the airport.
Before we release the news to the world about your arrival. So today we'll be doing that first ultrasound after the pregnancy test. They'll take some measurements to reaffirm if your due date is still what they think it is, or you're as far along as they think you're supposed to be, and then hopefully be able to see a heartbeat. And well, we definitely need to see a heartbeat, and then hopefully we'll hear the heartbeat audibly on the screen. As normal, I'll be down in the car waiting while your mom is inside the appointment, and then mom will bring the camera up there with her to record the process, and hopefully we'll see some good footage and maybe even pick up the heartbeat, so you can see the first visual confirmation of life for you. So that'll be pretty cool. And then hopefully mom's mind will be a little bit more at rest. She has already taken three pregnancy tests since the pregnancy test to make sure that you were still in there. She does sneeze a lot, so I guess she was afraid of shooting you out. But we'll see, and we'll talk to you on the way back. All right, so hope to hear from you soon with your heartbeat. All right, bye.
Is that my little blueberry?
There's your little blueberry in there. It's never, when things are not good, having that on video is like the worst
Right.
thing ever.
Yeah.
So I have learned my lesson
that.
that like, if it's not gonna be good, let's not get in the video. So this is the uterus right here. Here's our little blueberry. And you're gonna see the little heartbeat in a second. Let me get this.
Look at your big head.
Yeah. Hi, little munchkin. Look at you, tiny little guy floating in there.
Told Raphael I'm gonna give birth to a cat.
Ah! Let's see, we're gonna turn the little connector over here. Let me help you get a little bit better view. Yeah, so we'll get this going here. And then here's our fetal ball right there.
Oh,
Yeah, and you see that guy?
yeah.
There's our heartbeat.
Like a little tadpole.
It is like a little tadpole.
Oh my god,
Yeah,
it's like a little peanut.
And then let me get a picture for you. You're perfect. Absolutely perfect. And then let's get our heartbeat on there. Oh, you can see that. Here it is. You ready?
I hear it.
Yeah, you hear it? That was you laughing that it just picked up.
Oh my God.
That's perfect, my friend. It will get stronger and stronger over the next couple of weeks. It looks great. Make sure there's just one in there. Yep.
It's too early to determine the gender, right?
Mm-hmm.
Or the sex. Yeah.
That looks great.
Hey you, it's us, your parents.
It's official.
We are on our way back from UNC Fertility. Awesome news, they updated their stuff, so I was able to go upstairs for the appointment.
That was dope.
So that was pretty cool. A couple minutes or a couple seconds, not too long after Mom left the vehicle, she called me and said that I could go, so I was able to get up there in time before the appointment started. So it is official, you have a heartbeat.
Yes.
And
We saw you.
we saw you doing nothing in there, you lazy son of a gun. You measured 7 millimeters
A little under. Yeah.
for your crown to rump measurements.
Ooh, rump.
Your little rump was only 7 millimeters away from your nugget. So,
Just like your mom, you don't have a butt.
so good job. Awesome work. How'd you feel about the appointment, and how do you feel now?
Still very surreal to me. When I heard your heartbeat, that sealed it for me. I'm gonna cry. Okay, bye.
So far they didn't see any abnormalities or anything. Within a couple seconds she was saying, yep, you're looking perfect, so that's good. Must be those Asian genes getting good marks in school, in labor school. So we're super pumped about that. Super happy that everything's still going good. So we've got one more appointment in 10 days over there for the final ultrasound with them, and then we will switch to a regular OBGYN who should be the catcher of you when you pop out. But that we'll go shopping today for an OBGYN and see where we end up there. So yep, only one more appointment out here in Durham, and then the rest will be back at home. So exciting stuff, lots of movement going on. All right, so we'll see you later. Bye bye.